Okay, go ahead.
Okay, so osteopathic medicine it focuses on healing the body as a whole and looking at the body as a whole. And osteopathic doctors or physicians are able to diagnose and treat patients with various illnesses based on looking at their whole body and using the whole body to heal them. Next. So in order to become an osteopathic physician, you need a degree in osteopathic medicine. So usually preceding that, you have a 4-year undergraduate degree, and then you can also have other advanced degrees. And that helps you get into an osteopathic medical school. Osteopathic medical students study the same as other physicians, except they also have an additional 200 credit hours of osteopathic manipulative medicine, which just teaches them how to adjust the musculoskeletal system to treat the body. Next.
So it's founded in the 1800s by Dr. Andrew Taylor Sill, a medical doctor in Kirksville, Missouri. It recognized current medicines causing more harm. He worked on natural remedies to help cure. He worked with patients to morph treatments to help each individual patient and promote and assist patients' natural healing powers internal to their body. So today, the first school was set up in 1892 in his home. In 1915, the first 4-year degree was developed and sanctioned by the AOA. Osteopathic medicine is now referred to as DO and is a separate degree that shows specialty in alternative medicine and healing.
All right, so training available, there are 48 teaching locations in 31 different states. There are 6 that are publicly controlled and 27 that are private. And now 20% of all doctors in medicine are getting some sort of education that includes osteopathic medicine. Next. There we can see a graphic with all the states where you can find where there are included osteopathic medicine.
Okay, so there are a few principal figures in the development of osteopathic medicine, and the first and major one was Andrew Taylor Still, and he was just the founder of this type of medicine. And then there were a few people who helped with the progression of this osteopathic medicine. And so this is just a list of a few of the supporters of that because it wasn't super well known. And so over time, it slowly became more and more popular. So Mark Twain, he was a vocal supporter, and he spoke before the New York State Assembly at a hearing regarding the practice in that state in New York. So, and then Harry J. Walter was the first osteopathic physician to take the oath of office as a military physician. Barbara Ross Lee was the first appointed African-American woman to serve as dean of the Ohio University College of Osteopathic Medicine. And then Ronald Blank was appointed to serve as Surgeon General of the Army and was the only physician to hold that post. And how does osteopathic training differ from the traditional medical school training? So osteopathic students learn what traditional medical students do, but they emphasize on allowing the body to heal without the overuse of medicines, and they are trained in special areas that normal medical schools don't train in. So they just focus on like health education, injury prevention, and disease prevention in a natural way.
Abraham Flexner did a study of medical education in the United States and Canada, and he published a report in 1910 that criticized medical schools for allowing just anybody to enter into them, and they weren't very science-based, which he stressed that they really should be, and that students needed more lab hours actually practicing medicine instead of just sitting and learning it. He put a special pressure on unconventional medical practices, saying that they needed to be more science-based, and his report actually reformed kind of medical education today. It led to more medical programs being university affiliated, and it actually led to some medical schools being shut down and others joined together to create a better medical education system. Next.
For this part, I interviewed Dr. Regina Hammock, and I asked her the following questions. Why did she choose to become an osteopath rather than a doctor in medicine? And does she feel that there are important differences? What are those differences? So to this, she answered that she came across the concept of osteopathic medicine when she was in her third year in St. John's University. Some people came to promote the New York College of Osteopathic Medicine, and at that time that school was about 10 years old. They were explaining the concepts about osteopathic medicine and demonstrating osteopathic manipulative medicine, which is a core set of techniques of osteopathy. They talked about how they were becoming familiar with how the body works, and someone mentioned that she felt confident with touching her patients in the hospital, and somehow this created a bond between the patient and the doctor, and they appreciated that. Dr. Hammock discovered that osteopathic doctors really do have a healing touch, and patients need to feel that, and it goes a long way in speeding treatments. This was one of the differences she noted, that doctors in medicine do not touch their patients. Next. And so this was one of the main differences that she saw, in that osteopathic doctors, they handle the treatments differently, and they do touch their patients when doctors in medicine don't. Okay, next. And the other question was, are there feelings of competition between doctors in medicine and osteopaths? And according to Dr. Hammock, there are people who want to go to medical school so badly that they will do anything to be a doctor. They think that there are only doctors in medicine in this planet, and everyone else is below them or is second class. So in her experience, osteopaths do quietly their job, but they do it efficiently, and they serve in big and small communities, and they take care of their sick patients. And osteopaths also live in a way that is more relaxed, a little more loose, and yeah, this is one of the other differences from doctors in medicine. So osteopaths really appreciate the talent that they have in their hands.
All right, good job. You covered the topic really well and taught me about osteopathy a little bit. That's great. I ask each student the same question at the end of their presentations, and I'm going to do the same thing here. So I'll ask you first, Marin. What was the most interesting thing that you learned as you were studying this topic?
To be honest, I had no idea what osteopathic medicine even was. So, just the fact that it's out there and I was unaware of it beforehand, and just how cool it is to that they work with it more of like a natural way, and it's not so medicine based. I really like that. So I don't know, just more of like the knowledge that there's like a different option out there, if that makes sense.
Yeah.
That's probably the biggest shock or like difference that I found, just because I had no idea that it even existed. So.
Great, thank you. All right, Dominica.
Yes.
Same question. What was the most interesting thing that you learned while you were studying this topic?
Well, I also didn't have an idea what osteopathic medicine was, and so it was really nice to be able to learn how this is another field of medicine that I think that it even requires more from the physicians, because they have to do like their regular like training for med school, and plus they have to prepare in the osteopathic field. So I thought that was admirable that they have like a talent in their hands to literally heal people just by natural means, rather than like giving people a lot of medications. And I thought that was interesting. Where I live, it was very hard to find an osteopath. And I found one in my city, but he was really busy and he couldn't help me with an interview. And so I thought that was like something cool that maybe I can apply in where I live, healing people in a natural way. So I thought that was cool.
Great, thank you. All right, Brooklyn.
Same question.
Yep.
Hello?
Can you hear me?
Oh, yeah, now I can.
Yeah, same question.
Okay. Yeah, I really liked that it was more of a hands-on approach, because a lot of the time you go see a doctor and they just kind of ask you questions, whereas an osteopath focuses more on the body and like healing you physically instead of just writing you a prescription. And yeah, I like that they look at the body as a whole, because it's not always a localized problem. And that's what I liked.
Cool. Awesome. All right, so I'm going to stop recording, but stay on for just a sec.